My name is Maggie A. Frazier. I am a genetic counselor at Duke Health. I see patients who have either had a cancer diagnosis at a particularly young age, or who have multiple relatives in their family with cancer, or maybe have a particularly rare type of cancer, like an ovarian or a male breast cancer. And some people that I see may or may not have a cancer diagnosis, but they have lots of relatives in their family with cancer. When we see those indications, that makes us start thinking about hereditary cancer syndromes, and that's a good time to see a genetic counselor. Because a genetic counselor, like myself, can sit down and talk with the person, review their family history, review their medical history, find out how suspicious we are for a hereditary syndrome. If we identify a higher risk for cancer, we can do things to combat that risk, like screening more frequently, or screening for cancers we're not already screening for, or using more sensitive imaging devices. We can sometimes even consider risk-reducing surgeries. Another thing that we can learn from this genetic testing for people who are battling a current cancer diagnosis is if they would be eligible for targeted therapies. So that is another benefit of talking with a genetic counselor and pursuing genetic testing. Everybody's coming from a different circumstance. They may have had a day full of sessions and they're coming to me and their brain is joggled from all the information that they've received. So I like to figure out where the person I'm talking to is at and what they want out of me. One of the first things I ask is what did you know about this appointment and what is on the forefront of your mind, so that we can go ahead and address those concerns.